So the difference between a cold and the flu are that they're caused by different viruses. And so the flu is caused by the influenza virus, and the common cold is caused by many different other types of viruses, but is not caused by the influenza virus. Symptoms of a common cold include cough, sneezing, sore throat, sometimes a low-grade fever, runny nose, and nasal congestion or stuffy nose. Symptoms of influenza include fever, usually a little bit higher than that with a cold, up to 102 degrees Fahrenheit, myalgias or severe muscle pain, fatigue, exhaustion, and weakness, as well as cough, runny nose, nasal congestion, and sneezing. Complications from influenza are actually quite uncommon, but can occur in young children or in elderly adults or patients with other chronic medical problems. The most common complication is pneumonia or infection of the lung, and this can happen from the virus itself, or it can happen when you get a bacterial infection on top of the viral infection. Unfortunately, there's no cure for the common cold, but we are able to help control symptoms. I would advise that you talk to your doctor before you start any medication for symptom control, as they are contraindicated in patients with some medical problems. So for cough, we're able to use cough suppressant medications. For runny nose or nasal congestion, we can use decongestant medications. For mild pain, from the sore throat or from headache, from fever, we can use mild pain relievers such as acetaminophen or NSAID medications such as ibuprofen or naproxen. And there are other more conservative measures that we use as well, such as heated, humidified air. And I would lastly like to say that antibiotics are not effective in treating the common cold. They're targeted against bacteria and not viruses. It is recommended that everyone over the age of 6 months get an annual flu shot, and usually they're given in the fall before flu season starts. There are two aspects of treatment of the flu. The first is symptomatic management. The other is a medication called Tamiflu or oseltamivir or other similar medications, which can be used in some patients to shorten the duration of illness. Patients who have had symptoms for less than 48 hours, have other chronic medical conditions, or require hospitalization may be a candidate for Tamiflu. I would recommend contacting your doctor immediately if you suspect you have influenza or have been exposed to someone who has influenza. And there are two reasons for that. The first is that you may be a candidate for Tamiflu. And the second is that patients can become very ill with influenza infection, and it's important to touch base with your doctor.